What is health insurance? Health insurance is a contract between a company and a consumer. The company agrees to pay all or some of the insured person's healthcare costs in return for payment of a monthly premium. The contract is usually a one-year agreement, during which you are responsible for paying specific expenses related to illness, injury, pregnancy, or preventative care. Health insurance. Health insurance agreements in the United States generally come with out-of-pocket costs that must be paid before coverage begins, such as 2. A deductible that requires the consumer to pay certain healthcare costs out of pocket, up to a maximum amount before the company coverage begins. 1 or more co-payments that require the consumer to pay a set share of the cost for specific services or procedures. How health insurance works. In the United States, health insurance is tricky to navigate. It is a sector with a number of regional and national competitors, whose coverage, pricing, and availability vary from state to state, and even by county. 3A, little over half of the U.S. population, has health insurance coverage as an employment benefit, with premiums partially covered by the employer. The employer cost is tax-deductible to the payer, and the benefits to the employee are tax-free, with certain exceptions for S-corporation employees. 5.6. Self-employed people, including freelancers and gig workers, can buy insurance directly from insurers on their own. The Affordable Care Act of 2010, commonly called Obamacare or ACA, mandated the creation of the ACA healthcare insurance marketplace, which allows individuals to search for and purchase standard plans from private insurers that are available where they live. The costs of ACA-based coverage are subsidized for taxpayers whose incomes are between 100% and 400% of the federal poverty threshold. People over the age of 65 and those with disabilities, end-stage renal disease, or ALS, qualify to receive federally subsidized care through Medicare. Families whose incomes are near the poverty level are eligible for subsidized Medicaid coverage. 8.9. Types of health insurance. Health insurance can be tricky to navigate. In the U.S., managed care insurance plans require policyholders to get their care from a network of designated healthcare providers. If patients seek care outside the network, they must pay a higher percentage of the cost. The insurer may even refuse payment outright for services obtained out of network. 10. Most managed care plans, such as health